Joining me to talk about it is Dr. Rochelle Villanueva, an OBGYN and the president of the National Medical Association. Her organization is one that signed on to this and represents more than 50,000 Black physicians across the country. Good morning, doctor, and thank you.
Good morning. Thank you for having me.
Explain the urgency of this call, because it's stunning to me, but it's a reality that there are ER nurses, doctors, employees across the country who are not vaccinated, and some of whom have died from COVID as a result.
Right. I think the urgency of signing on to that statement was just what you highlighted in the segment before. The Delta variant is aggressive, surging, and targeting unvaccinated individuals. I think it's a very powerful statement that you had almost 60 healthcare organizations, professional societies coming from all segments of the healthcare system advocating for universal mandate of healthcare workers. We know that in order to keep our patients safe, which is a priority for us, we need to have all workers vaccinated. Mm-hmm. And this is not an unusual concept. We are required to have vaccinations for many things as healthcare workers in hospital systems, influenza, right, hepatitis B. So this is very common for us.
You're an OB, as I mentioned at the top, and there is very troubling data when it comes to how many pregnant women have chosen not to get vaccinated. The CDC study that came out in June, so not that long ago, showed that just 11% of pregnant moms at that time were fully vaccinated. I want to show people this tweet or an Instagram post, I think it is, from actress Emmy Rossum, who just has a newborn daughter there. And she shared that she got vaccinated while she was pregnant, how safe it was, and that she just learned her daughter now has antibodies protecting her from COVID-19. What is your message to pregnant women who still have not gotten vaccinated?
I think my message to pregnant women and to all that are eligible to get the vaccine that are not vaccinated is to get vaccinated. The Delta variant is not something that we can play with. I see patients every day, and I ask every single patient, pregnant or not, have they been vaccinated, and encourage them to get vaccinated if they haven't. Mm-hmm. We understand why, especially pregnant women, may have concerns about vaccination, about receiving the vaccination. Pregnant women were not included in the original studies, but we have the manufacturers have had an extensive safety system that has been collecting data about women who are vaccinated in pregnancy. The data does not induce any fear about safety concerns. So there was no adverse outcomes for pregnant women who received the vaccine. That's out of proportion to what would normally happen in a pregnancy. So there's no safety concern there thus far. They're still collecting data, obviously. But what we do know is that pregnant women, although the risk is not high, are at higher risk for severe disease in pregnancy if affected by COVID. So they go to the hospital more, they undergo mechanical ventilation or have to be on a ventilator to breathe, and unfortunately die at a higher rate. So it is very important.
It's such an important message from the expert. Thank you very much, Dr. Rachel Villanueva. We appreciate it.
Thank you.